Do you have knee pain every time you run, jump, or possibly just even going up and down stairs? Then you might have what we call patella tendinitis, or where it's more commonly referred to as jumper's knee. Today I want to explain what that is, how do you know if you have it, what you can do in your own home to help it, and when you should seek a professional about this. If you like this content and want to learn more, please visit us at physical.com/Hazelton and like and subscribe our YouTube channel. Hi, my name is Anthony, a physical therapist here at Physical Therapy and Balance Centers in Hazelton, and today I'm going to explain to you a little bit more about patella tendinitis. So what is it? Basically, patella tendinitis is inflammation of the tendon or connective tissue that connects your kneecap down to your shin bone. So this could occur from a variety of reasons, but a lot of times it's because of overuse. So this type of injury is very specific to the area, so you can almost feel it. You could actually touch the area and you should know if that is painful or not. And like I said, this happens when we do things like repetitive running, jumping, lifting, or any high impact activities. When you have patella tendinitis, you should feel the pain right below the kneecap, and this pain will occur during the activity. So things like running when your foot lands on the ground, jumping, same situation when your feet land on the ground, squatting as you go down, or even getting up and out of a chair, more likely when you're going down than coming back up. So if you think you have patella tendinitis or jumper's knee, what can you do at home? Let me explain. First off, I like to tell my patients, you're going to want to heat that area up before activity. By heating the area up with a hot back or an electric heating pad, you're going to increase blood flow to the area, making it easier for the activity to occur and less pain to occur during the activity. It's also very important to note that ice after will help with any inflammation that may occur, especially if pain did happen while you were doing that specific activity. We like to do certain stretches for this area, more specifically a quadricep stretch for the front of the thigh, maybe a hip stretch if you have tight hips. We found that a certain strap or bracing around the tendon helps deload that area, making activity less painful. Specific types of massage can help as well. Massage of that quadricep to loosen the muscle tissue, or of the specific patella tendon will help with tissue healing and mobility. When it comes to exercise, we like to use something called an eccentric exercise or strengthening, and that is basically a negative. It would be something like lowering your body down with the affected leg and then using the unaffected leg to help yourself back up. By doing so, you are strengthening the tendon in a safe range. It's important to note that while doing these exercises or activities, we don't ever want to overdo it. It's, the old saying, no pain, no gain, does not apply here. If you do have any pain, you want to stop or modify the activity in order to prevent further damage to that area. So how do you know when to go seek the help of a trained professional? So if you try these home remedies for a week or two and you're still not seeing relief, the pain might be an 8, 9, or 10 out of 10, and it hurts during all activities like walking, going up and down stairs, or getting in and out of a chair, you might want to seek some help. And what would that help look like? Here at Physical Therapy and Balance, we could use specific tools like our diagnostic ultrasound to tell how bad the damage may be, and then we could use other modalities to help with the healing process that you might not have at home. So if patella tendinitis or jumper's knee sounds like something you might have, please try these exercises at home. And if you have any questions, please feel free to call us at Physical Therapy and Balance.